Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.
Hi, and welcome to our show. My name is Rick Schneider, community educator at Fairhope Hospice and Palliative Care, home of the Pickering House. In fact, we are enjoying ourselves in the Pickering House as we record. And Denise, we're going to have a pretty interesting show today.
I think so.
Joining us is somebody world famous. Would you mind introducing him?
I would love to introduce him. So to my left is Dr. Brian Varney, and he is our Chief Medical Director here for Fairhope Hospice and Palliative Care. So welcome.
Thank you, Denise. Glad to be here.
You know, one of the things when I'm out in the public, we have 4 doctors, and people say, well, if they're terminal, what do you need a doctor for? And the doctors really perform a very valuable service as far as people who are ill still have symptoms, they still have other things wrong, and we do need doctors to take care of our people on service. So I guess, Dr. Varney, right out of the chute, what made you come to Fairhope, being a medical doctor?
Actually, hospice has always just been something that's just really spoke to me. As a third-year medical student, I was fortunate enough to spend a rotation with Dr. Underwood out in Newark, and she's since passed on, but she made a great impression on me and my direction, just with seeing the caring, the loving, the tenderness that she provided to her patients, and went with her to visit patients in their homes. And that just opened up a whole new world for me that I hadn't thought of as an up-and-coming student. So from that third-year medical student experience on, I started looking for hospice experiences everywhere I went. So in my senior year at Grant Medical Center in my residency, Dr. Tim Moore had an idea of starting a palliative care unit. So I helped him with that. That was one of my big projects in my senior year there, was getting the palliative care unit going there. Then when I got down here, I started, before I even saw my first patient in my office, as I was setting up my private office, I found Fairhope Hospice, wandered in one day and introduced myself, and Denise asked me to come and serve as a volunteer. Yeah. So I started volunteering with Fairhope before I ever even saw my first patient in my practice.
So many people that are employed start out as volunteers. And it's amazing. And you brought up something else in that you noticed the care and the compassion, the empathy while you were on your third, making the rounds.
Right.
And many of the medical people that come to us, nurses, aides, and all that, they came because where they were at, the way it is, and it has to be, is hurry up. When you're in a hospital or in a nursing home or a doctor's office, you don't have time to sit down and ask about the kids. You got to keep it moving. Or what about Trump? We won't get that started. But, you have time to talk at hospice, and you don't in the regular medical field. And it really does attract some very good people here.
I think so. I think one of the biggest privileges we have is the privilege of time. We allow our case managers to set their own schedules, where they arrange their patient visits based on their patients' schedules, and they can spend the time that's necessary. Obviously, we have productivity. We have to make things happen. Yeah. But at the same time, they have a lot of flexibility to allow themselves to spend the necessary amount of time with the patients when they need it. And as the doctors, we take away from our private practices in order to dedicate the time that's needed here so that we can spend that time as well.
I was shocked. When you were talking, we allow everybody to set their own schedule based on the person who's ill schedule.
Yes.
They don't have to adjust their schedule to come here.
Right.
And that's such a hallmark of Fairhope, in that we're here to comfort, and one of the ways it's comforting is, what do you want? When do you want us to come? And all that. And that's a very good point that you brought up.
Right. One of the best aspects, I think, of hospice care is that it can be provided anywhere and serve any need. Basically, hospice is a home health type of an organization. It's meant to be delivered in the home. But there are some folks that either have symptoms that can't be managed in the home, or the family and the caregivers aren't comfortable doing what needs to be done in the home. And that's why we have the Pickering House. When Denise had the the brainchild of bringing this into fruition. It just it became a very large project and took over a big part of Denise's life when she was bringing this place to exist, and we've been blessed to be able to serve the community in the way we do.
Well, and you're right, it is. We are basically a home health agency. And, you know, Denise, you have visited in your earlier career, you were a home nurse or visiting nurse. And we would come into some very interesting homes, and it's their home and not ours. So, you know, they keep it as is. You know, people are thinking, okay, if you come in the house, I know my mom would be doing the dishes even if she was the ill person. She'd be dusting before they got there. You know, in fact, my brother and I almost burned down our house one time. We called the fire department. They're coming. We were filling a lawnmower in the garage next to the water here. It's a whole nother show. But she was fixing everything up because the firemen are coming. Mom, priorities here. But, you know, we do accept people where they are and how they are. So that's another good point where people are a little hesitant to call us. You know, it's really, we put the control back to them.
Exactly.
Everything. Now, Denise, you probably have been in a few interesting homes.
I have. And, you know, over the course of the many years, you know, I think, you know, something I always appreciated was being able to help people achieve their goals and their journey, and to be able to stay in their home with their loved ones if they wanted to. And, you know, like Dr. Varney said, you know, sometimes that's not possible, but we do everything under the sun to make that happen. Even if someone's in a facility or here and want to go home, you know, we move heaven and earth to make that happen. But we do provide care in nursing facilities, assisted livings, and, you know, oftentimes, you know, that works well for families. But then, you know, we do, like Dr. Varney said, we have the Pickering House, and, you know, it's not really a home. It's kind of like a home away from home, but it's not someplace where people could actually stay and live for an indefinite period of time. So that's probably a little bit of a educational, you know, I guess, project for us, is to educate people as to why we have the Pickering House. I mean, like you said, we're very blessed. There's not that many in the state of Ohio. So we're blessed to have this right here, you know, in our community, so we can keep people here. But, you know, why we use it is, you know, another story. And sometimes we use it to bring people in when the families are just tired and they need a break, and we call that respite. And then our medical directors are really involved when we have patients that have a symptom that needs managed, which is general inpatient care. So, I mean, Dr. Varney, I think that's, you know, a huge role of the medical director, is to, you know, help with that symptom management. And, you know, we use the Pickering House oftentimes for that.
Yes, the medical directors, basically, there are 4 of us that are actively serving as medical directors. One is sort of an emeritus, but there are 3 of us that actually do rounds here at the facility. We'll usually take several days together, so we have some continuity. But our role when the patient is here under what's called GIP, or general inpatient status, is to try to manage any of the symptoms that are presenting.
And if I can interrupt, what kind of symptoms?
Right. Any symptom that may be either related to their terminal illness, or even symptoms that are related to other disease processes that are just coincident. But basically, we're talking about things like the obvious: pain and shortness of breath, anxiety. But any of those symptoms that arise toward the end of life, when the body is starting to go through changes, the body and the mind both interact, and those changes will create symptoms. If we're dealing with pain, we are on call 24 hours a day to make adjustments if needed.
Wow.
If we're dealing with feelings of breathlessness or shortness of breath, there are medications we can use to support the patient and take those negative symptoms away. So the way I explain it to people is that when you come to see me here at the Pickering House, we all realize that the medical community has very little they can now offer to fix things. But my job here is not to fix you. You know, my job is to make all the bad parts go away, while there's this process underneath it all that it's continuing to move forward that we know we can't fix. But I can still chase away the bad stuff.
Boy, acceptance is the word. We know we can't fix.
Correct.
That's the pill that is hard to swallow. You know, there's got to be something we can do, because look at all the technology, look at all the knowledge, look at all I've been through.
Sometimes it's bigger than us.
Yeah, absolutely. I remember when I was diagnosed, I have Crohn's, and it was like a few years ago I was diagnosed. I didn't think I deserved it, for one thing. And I was going to call our pastor, see if I could get my money back. You know, I gave all this money to church, and this is the thanks I get. You know, it's hard sometimes to accept how things are. Mm-hmm. You know, you deal with that quite a lot when, as a physician, you're saying, nothing we can do.
Right.
That's, I think, what gets everybody, that's the hard part, to finally say, and I guess many times we get people, I don't want to say too late, but right towards the end.
Right.
And because people say you call hospice and then they die, well, they're already dying.
You know, that's a great point, Rick, because oftentimes people feel like there really isn't anything that can be done. But I think that's the advantage of palliative care and hospice, is there is a lot that can be done. And because of our great medical team, we can get people comfortable. And actually there's studies that show that if people's symptoms are managed and they're comfortable, that it actually extends their life. Mm-hmm. So sometimes people have come on hospice and we thought their prognosis was very limited, and actually because we get those symptoms managed, we get them feeling better, they do better and they actually live longer. I mean, to see studies like that, but there is a lot we can do. And so oftentimes, people feel like, well, where can I turn? What can I do? I think we're a great answer to support, and it's because of the team. Of course, the physicians. We're talking to Dr. Varney today. Huge part of what we do, and of course, we work with people's physicians in the community as well. But our doctors kind of back that up, and sometimes people may not have a physician that wants to manage their care at the end. Mm-hmm. They totally manage that. But then you've got the team of the nurses and the social workers and chaplains, volunteers, aides. I mean, the whole gamut of people that really help.
Mm-hmm. I guess as medical director, do you kind of ride herd on everybody coming and going? Because
they coordinate a lot of it.
Yeah. I was going to say, we have a large team that's involved, and they do go to the home. I guess one question is nursing homes. We take care of people where they live. If they live in a nursing home,
yes,
we take care of them.
We can take care of folks at any level, whether it's a home, assisted living, a nursing home, intermediate level of care, or even here at the Pickering House. We also do take care of folks at the hospital.
Boing. That's something that I think a lot of people don't realize, because there's so many things going on that at a hospital they're curing, but they do have the palliative wing or something.
Yes.
And I know we do No One Dies Alone, and they've sometimes been in the ICU, so we do deal with the hospital.
Absolutely.
People don't think that, if how the hospital deal with us, I guess, but we get along very well, so that's kind of an interesting segment of it. But I know a lot of people are in the nursing homes. Do they enjoy us having the nursing home? Do we get along, I guess, would be a...
We like to hope so. I think we have good relationships with all the facilities here in our community. We are the preferred provider in our community, and everywhere I go with all the facilities where I serve, there's always a connection to Fairhope Hospice. The patients benefit from having the added services. The nursing home staff are limited. That's a business as well, and they have margins that they have to operate within. So someone that has a higher level of need will sometimes not always be able to get all of their needs met without the hospice service. And once the hospice service comes on board, then there's extra eyes on. There's an extra nurse. There's an extra aide, or multiple aides sometimes if necessary. And so they get a little bit of extra tender loving care there in the facility, which kind of fills those voids that might be developing.
Yeah, I know I've been, as a patient contact volunteer, I've been in the nursing homes, and Denise, I think one of the things they like is that our aides help their aides. We don't compete or anything, and our aides, by the way it is, have more time.
I think that's one thing that people sometimes ask, well, why, if they're in the hospital or in a nursing facility, why would you have hospice when they have care? But people that have terminal illnesses or at the end of life or just are very ill, like our patients are, they may not be the very end of life, but they're certainly have a serious condition, they need that extra support. And so, like Dr. Varney said, we're the extra eyes and ears. Our nursing staff and such, but we want those patients to have the extra special care they need. So it is nice that we have that staff that can go in and provide the care. And, so if somebody wants, a bed bath every day or wants to get the shower, we can do those kind of things.
Wow.
To assist. And, like you said, the facilities are very busy and they appreciate that extra help. And then we actually have, our nurses and our other staff are all especially trained in pain and symptom management. And so we know what maybe their needs are, and we can assist the staff. So oftentimes, let's say in the middle of the night, like Dr. Varney said, we're 24 hours a day. In the middle of the night, if a patient has a concern or a problem, they can call, and our nurse can come over. And that's huge. When you're a nurse at a facility and got a lot of patients to take care of, to be able to call a hospice nurse, or a palliative nurse to be able to come over, that's important. And then our doctors are available, and pharmacies available for us. So, we don't stop during, in the evenings and
8 to
nights.
5,
We
yeah.
are still busy. We've got fresh staff that are, available in the evenings and weekends that haven't worked during the day, so they're ready to go. And they go out and visit patients at night. And I think, that to keep people where they want to be, that's what we have to do. And so staff do that.
The neat thing is that when you call us 24 hours, 7 days, Christmas morning, 4th of July, it doesn't matter, a human answers the phone.
Yes.
Your call is so important, we actually answer the phone. I always like when they say your call's important, please press 1 for something.
Right.
But I guess Dr. Varney was kind of in the same vein, I don't know, but you almost, as well as being a medical doctor, you almost have to be a psychologist, and you also have to be a chaplain. You have to be a lot of things to work at Fairhope.
We do wear a lot of hats, and we do have every discipline provided here. We just completed, every Tuesday morning, we have what is called our interdisciplinary team meeting. And that IDT approach is actually the best way to practice medicine, because it brings all disciplines together at the same time in the same room, so that there's not a breakdown in communication. So we all come together and discuss the care needs for the patients. So we all kind of benefit from each other's expertise, and we all kind of learn from each other. So I feel like I know a little bit of social work because of being able to sit next to the social workers. I know a little bit of nursing because I hear how the nurses provide their care, and hopefully they're getting a little bit from me as well. Our chaplain is there. The administration joins us for the meeting.
That's important.
Everyone comes together for that time so that we can know that we're providing the most complete care for every patient.
Yeah, when you're talking about it, I like what you brought up, because we do have billing, we have human resources, we have everybody there. So when they're talking, if financial's talking to families or the bank, they can convey what we do.
Correct.
There's a family in here that something happened and they can relate to that. And I remember as a patient contact volunteer, I've been doing it for umpteen years. This would have been like 2000, maybe 1999. I had some questions about a patient when I visited him at the home. Something wasn't right, and so the volunteer director said, "Would you want to come in and tell the staff?" I go, "No, but I'd like to listen." So long story short, I came into team as a volunteer and told them what I saw, and they listened. And they came up with suggestions. And one of the things you brought up about the team is sometimes if a nurse is in a situation, another nurse can offer suggestions.
Correct.
Or another social worker could say, when that happened, here's what I did.
We draw on each other's experience.
Absolutely.
Another interesting part of this, as we're talking about our interdisciplinary team meetings, is we have our grief support staff there. And you think, well, the patient's still alive. Why? But they actually get to know the family sometimes before the patient passes on, and that way they're there to support them even sometimes through that journey, because
Wow,
sometimes they're
interesting,
feeling and sometimes people are feeling the loss before the patient ever dies, that
Right.
loss of that relationship or whatever. So I mean, to even have our grief team as part of
Yeah.
that team, I think is really important. And then they can convey things back and forth, even sometimes even after the patient passes on, information that's important for the team to know.
It's sort of like when you think about in other areas of medicine, for example, in pediatrics, when you take your baby to the doctor shares with you what is called anticipatory guidance.
Okay.
So at their 4-month visit what to expect between 4 months and 6 months. We do the same thing with the grief team. There's also anticipatory grief, and we provide that same type of guidance because we want them to know and be prepared. We want them to know with each patient, each disease process, what they're experiencing now and what that means,
Mm-hmm.
but also, before I see you next time, what other symptoms might you experience? And what kind
Yeah.
of things might you see happening? So if you take away the unknown, you take away the fear.
Yeah. Well, and I learned about anticipatory grief about a year before I came on as a volunteer. My mom was in a nursing home up towards Mansfield where my brother lived. And I go visit her, and each week when I come up, I go on Sunday morning before church, I could see a change. And I remember I'd start tearing up on the way home. I knew what was happening. I wouldn't face it. I knew what was happening. And I finally had to face it, but I would cry on the way home because I could see my mom deteriorate. She hadn't passed yet.
Mm-hmm.
But it was obvious. And, that acceptance is the hard part.
It's key.
I could see it coming, but I know when I go to team because I like to convey what we do at Fairhope, and the best way to do it is hear what the staff deals with. I think one of the things you don't think about is weather and terrain. We visit people where they live, and I remember Laura was one of our nurses at the time, this is years ago. She would go to the home way out in the county, and she'd go down a long gravel drive, go through the creek, there was no bridge, and hopefully the water was down, and then go up a big hill one time and it snowed, and she got across the creek because she couldn't walk across, but she couldn't get up the hill and she had to walk up. And she said when he went on the door, the husband of the person on service answered the door, and she was solid white from the snow coming in. He said I thought it was a Pillsbury Doughboy or something. And she said, well, I had to get there.
Mm-hmm.
I remember someone that one time we went to visit, and they didn't have the house sat back in a field, and there was no drive, nothing, and we just had our boots on and trudged through the field and made it to the house. But there's all kinds of conditions, and that's when you feel like Claire Barton or something with your nursing bag on, and you think, I'm going to get there. But
Yeah.
we really, that's a lot of what we do. We just do what we need to do to take care of people.
Mm-hmm. Well, and you, doctor, do you also have a practice as well, or something, a clinic, or?
I do a couple of things. I serve as medical director for a couple of facilities in the community.
Okay.
I'm at Landfair Nursing Home and at Mount Aloysius, which is an intermediate level care facility.
Mm-hmm.
I run an addiction clinic here in town for a very small number of patients. We probably have about 70 patients that we provide services for here in town as well.
Okay.
In addition to serving here as the medical director, and then the other hat I wear is as the county coroner for Fairfield County.
And once every 5 years, you take a break, go on vacation. Sounds like you have a busy schedule.
Work hard, play hard. We
Yep.
we actually, my wife and I take quite a bit of time off to travel because
I
that's
would
how we
think.
reconnect.
Yeah, I would think you would need that, but I also think you have a well-rounded current life, if you will, the different areas where you work. The hospice would help to practice.
Mm-hmm.
You can understand what's going on in the practice. You can now understand the people coming on service.
Yes. It all connects, and that's the big thing in medicine today. There's a movement toward connecting all those aspects of care. For too long, it was always thought of as two piles of people. There's the healthy people and the sick people.
Mm-hmm.
And now, in my 20 years in practice, I've been trying to, when I teach, talk to my students and residents about this transition of care, where in the beginning, we're good.
Mm-hmm.
There's very little going on. In the middle, it's a little mix of both. And toward the end, it becomes palliative. And the last part of palliative is hospice.
Mm-hmm.
But that is not piles.
Yeah.
It's a gradual transition of how your care is received.
Yeah, that's very good. I'm still at the first part, over the perfectly
Where
healthy
everything's
age.
still perfect.
Thank you very much. I think sometimes that might be the hard part of aging is understanding what's going on.
Mm-hmm.
And we still get back to that acceptance factor. And I read somewhere where acceptance is to stop barking and start biting. So, you see a problem, let's do something about it. And I hope part of the reason I write and we do these things is so people can understand what we do. It is good. And I guess one of the things I hear, they're afraid to sign on because then it's good night, Irene. If somebody signs on, do they have any options to unsign on?
Absolutely. Nothing's ever written in stone. When someone wants to sign on to hospice, they realize that this is a decision they're making for a type of care they want to receive.
Mm-hmm.
And they can always change their mind and go back and pursue aggressive care if it becomes available.
Oh, okay.
Mm-hmm.
Is there any penalties or anything? Or
Not that I know of.
Oh, okay. So they can just sign off, just that easy?
They can, and then they can come back on. We just, have to always have physician orders and things like that. But absolutely, we want people to make decisions based on what's best for them. And it's their journey, it's their life, and so whatever's best, we're there. And so I think the ideal part of our organization is our palliative program, because there are times where people have signed off of hospice because they feel better and maybe the doctor offers them a new treatment. They can sign off and we can put them on our palliative program so we can still follow them, with, our staff, but yet, they're not in the hospice program. So the addition of our palliative care program has been tremendous. And we've actually increased the care we provide to that service over the last year or two. And so we serve a lot of patients in the communities, and if anybody wants information about that, I welcome to call us. We probably should do a show on palliative sometime. Just
We should, certainly.
Because I think that's a great opportunity we have.
And are you involved with the palliative end as well, or are they two separate?
They're two separate, but within the same family.
Okay.
I'm involved as far as oversight is concerned, and then if necessary, I can be available to give direct advice. The primary care doctors stay on board as managing those patients' care, but the nurse practitioners help as a go-between.
So I'm overwhelmed. I should have had a notepad here to write all these things down. You were bringing up so many points. Well, I didn't know that. So. Well, I think what we're going to have to do is we're going to have to wrap up the show here. It went a lot quicker than I expected. So, Dr. Varney, thank you very much for being on.
Thanks for having me.
Denise, always a pleasure.
Thank you.
I had a good time, and we're going to have to get going, so I'd like to remind everybody to celebrate life.
Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.